1 in 6 people get recurring headaches, and 10% worldwide report suffering from migraines. Well, June is Headache and Migraine Awareness Month. And joining us this morning to dive deeper into all of this is Dr. Walid Wazni. He's a neurologist with Dignity Health Glendale Memorial. And Doctor, thank you so much for joining us to talk about this very important issue.
Absolutely. Thank you for having me.
Doctor, I was telling you during the break that I personally suffer from migraines. I've been suffering since I was a teenager, and so many people can relate to this. We want to ask you just how common are the headaches and migraines, and at what point do you see patients coming in to seek some help?
Yeah, actually, migraines are pretty common. Actually, 1 in 5 people do suffer from migraines. So I typically see my patients when they start suffering, 1 or 2 headaches per week, and sometimes 4 to 5 per month.
Yeah, I mean, headaches and migraines, like I said, so many people experience them, and the degree of pain can range greatly. And I think a lot of people want to ask you, take advantage of the fact that you're here. What are the triggers? We hear, a lot of things that can trigger headaches and migraines, but can you tell us what exactly are these triggers?
Yeah, absolutely. So one of the major triggers that I see is food. So certain, certain cheeses, certain wines, like red wines, typically trigger migraines. Chocolates is a big one.
Right, yeah.
Exercise, certainly strenuous exercise can trigger migraines. Lack of sleep, that's a big one. And missing meals. A lot of people, if they miss, their lunch, they can develop migraines. And if you're a coffee drinker, make sure you don't miss your morning Joe.
Yeah, I can relate to that. Absolutely. A lot of us on the morning show can relate to that. You said food that we eat, the lack of sleep, and the coffee, right? Those are certainly big factors. Are there any other factors that can contribute to getting migraines and headaches?
Change in weather. So a big one is like the Santa Ana winds. That I hear that a lot. And stress. So stress can cause migraines as well.
Stress is a big one. And here's another question. We talk about headaches and migraines. Some people get headaches, but they don't suffer from migraines. Can you distinguish between the two?
Yeah, so that's a great question. So migraines is typically a dull unilateral headache, so it typically occurs on one side, sometimes both, and then it gradually increases throughout the day and it starts to throb. It affects your daily living, so you can't really function. It's difficult to work. And then it's associated with things like nausea, vomiting, and blurry vision. And typically people just want to be in like a dark room with no noise. And one of the things that's some people suffer complex migraines, so they actually have like neurological symptoms, so they get weakness and numbness on one side.
Oh, I can totally relate to that as well, unfortunately. Doctor, what are some of the things people can do, maybe at home, and at what point should people come in and see a doctor like yourself?
Yeah, I think, before you see a physician, you want to keep a headache diary and, document certain triggers, certain things that, trigger your migraines so that your doctor can better assist you. And I think if you develop migraines that are affecting your daily living, you really want to seek a neurologist because we do have medication and therapies now that can really significantly reduce your headache frequency and severity of that migraine.
So should people seek out their primary doctor or a neurologist?
Yeah, I would always just advise my patients that are listening that, we want to talk to your primary doctor, refer you to a neurologist so that you can be treated and diagnosed. And, there's also, in a certain population, there are secondary causes for the headache. So it's not necessarily a migraine, but it's caused by like a brain aneurysm or arteriovenous malformation. So, before we just want to say that we have migraines, we want to be properly diagnosed by the neurologist and rule out these secondary things.
Absolutely. Headaches, like you mentioned, can be cured with things like ibuprofen you can get over the counter. But, migraines are a different issue. You need prescription strength medication.
Yeah, so the great things about migraines over the last couple of years, we've developed migraine-specific medications. In the past, when I used to see patients, I'd have to prescribe them things that, were known to reduce headaches, like blood pressure medications and anti-seizure medications and antidepressants. But now, I can prescribe them specific medication that treat the migraine, so they don't have to have all those secondary side effects. So these medications now really work, and they typically don't have many side effects.
Yeah, and I can tell you they greatly improve quality of life. I can attest to that.
Absolutely.
Yeah. Thank you so much, Dr. Wazni, and you can find all of the information we just heard on this segment on our website, KCALnews.com/SeenOnTV.